Welcome to That Annuity Show, the podcast that will make you an expert in explaining annuities to your clients. Give us 30 minutes each week and we'll shave hours from your client presentations. Now, here's your host, Paul Tyler.
Hi, this is Paul Tyler, and welcome to another episode of That Annuity Show. Mark, how are you?
Paul, I'm doing great. How are you?
Good. Summer's almost, coming to an end. Are you doing anything good with the rest of the summer?
Trying to get away every weekend I can. I got one more weekend with my son before he goes away to college, so I'm going to try to spend this weekend doing something fun outside.
All right. Ramsey, how's Atlanta these days?
Atlanta's great. I just came back from a fun trip to New York, so it's been a good week.
Oh, okay. All right. Well, I was actually in the Hudson Valley, biking around Rhinebeck, New York, and Woodstock and Saugerties. Beautiful part of the country. Great time to get away. Now we've got a massive heat wave, but as summer comes to an end, okay, from our business perspective, open enrollment, right, for healthcare is just around the corner. So everybody's TV is going to light up. We're going to see more messaging around healthcare than we ever probably want to. But, it's an incredibly important topic in retirement. We haven't really spent a lot of time on healthcare. We think you're doing a plan about lifetime income, helping people think through income. You clearly have to think about and understand Social Security. We've had Mary Beth Franklin on and some other experts in the field, and we thought it would be good time to sort of talk about healthcare decisions. How do you pay? What are those options if you're recommending them to your clients? How are they going to fund them? And who better to bring on than an actual expert on the topic? And so I want to introduce a great guest, Terence Martin, who is head of life, annuity, and health research for Conning on our show today. Terry, welcome.
Thank you. Pleasure to be here.
Yeah. Can you just tell people a little bit about Conning and what your role is and the type of research you're doing in the
Sure.
healthcare arena?
Yeah, Conning overall is an investment firm that specializes in doing the investments for life and property casualty companies, as well as some health insurers. So that's the major focus of Conning. I'm in a department called the Insurance Research Department. And for our subscribers to our library, as well as any asset management clients, we put out a whole series of investment, some of them investment focused, but most of them insurance research on things that are going on in the insurance industry. I'm currently writing a series on ESG, environment, social, and governance. We do strategic studies on the life investment profile, on health products, on you name it. We touch on just about anything that hits the insurance space, and those are used by insurance executives to help set the strategic direction for their company and as background for if they're going into a new product and things like that. We also do forecasts for the whole industry and timely topics on we've been all over the COVID-19 pandemic and what's going on from the insurance angle on that. So that's kind of what Conning does and what I do inside Conning.
Excellent. Well, first of all, thanks for making time for us. And let me just kind of ask the very basic question, and then Ramsey, Mark, why don't you all jump in? So I turned 65. I have to enroll in Medicare. Correct, Terry? Can you kind of walk people through just the basic decision tree that I'm faced with because I happen to turn that age this year?
Okay. As you turn 65, yes, you become eligible for Medicare, and you are faced with, basically two major choices. You can go into traditional Medicare, and that's made up of several pieces. There's Part A, which is hospital insurance, and that covers, inpatient stays, some rehab as you come out of the hospital, those sorts of basic functions. Part B, which is all your physicians and those sorts of services. And then That's the traditional part of Medicare, but it doesn't cover everything. And you will hear of a product out there called either Medicare Supplement or Medigap. Same thing. Two names for the same product. And that fills in, as the Medigap name says, the things that aren't covered by Medicare. So it covers some of the deductibles, it covers some services, and I'm not certain of exactly all of them. It's kind of a mishmash of different things. But all those services are laid out in the description of the product. There's several versions of it. They have letter names, A through, I've forgotten what they're up to now, maybe H or I even. And they are standardized by those letters. So if you have company A and company B with a plan F, they cover exactly the same thing because it's defined as plan F. And then the last piece that people need to talk about is prescription drugs. That's Medicare Part D, D as in dog. And so you've got A, B, and D, plus your Medigap, and that gives you kind of the full gamut of traditional Medicare. You'll notice letter C has been missed. That has now become something called Medicare Advantage. And what you can do is you can take that whole bundle and trade it away and join essentially an HMO for your Medicare coverage. And there you are reducing who you can see to your network. And it's many of the big players are in it. So you've got your United, and you've got Humana, and you've got all the Blue Crosses are involved in it. So you've got these large networks, but you are limited to a network. And it also covers the physicians. It covers typically this prescription drug, not always. So pay attention. And you're trading it for that sort of a benefit that many of us, myself included, had that sort of benefit at work. And so it's simply transitioning from a work-sponsored one to something that's sponsored by a company that covers all your Medicare coverage. So those are your basic two choices. Within them, you've got a lot of different sub-choices, but those are your two different games. You stay with traditional Medicare A, B, D for prescription and Medigap or MedSup, or you go Medicare Advantage and have all that bundled into one piece. So those are your main decisions.
So, it's as if our life wasn't already complicated enough with so many other decisions with respect to managing our personal finances. And obviously healthcare is central to everybody. Right. It's not optional. And, what you've laid out there, is a multi-headed beast, right? There's a lot of things to manage for. So, I've learned something in this short, in your short description. So thank you for that. I think, one way to kind of bring it down to at least one sort of single parameter that would be helpful, certainly from my perspective, is how much money is involved here. Like, so in other words, you walk in, you've got Medicare, you've got Medicare, but there's all these other pieces you can add, and what kind of economics are you trying to defend against? Like, why are you adding all these other things? Like, can you still go broke is really the question with Medicare coverage, and is MedSup / Medigap the thing that's going to be your best defense?
First of all, how it's paid for, Medicare Part A is taken out of people who are working. That's the HI you see coming out of your paycheck. And so that's funded by that payroll deduction. Yeah. And it's provided at no additional cost to those who are now in Medicare. So it's paid by the society overall. Medicare B is taken out of people's Social Security checks. And so that's a premium that's set by the government. And it actually is now on a sliding scale, so that if you have higher income, you pay a higher premium for that. If you have lower income, you get a lower premium. So that is also taken out of people's Social Security checks. And if they're not collecting Social Security yet, they'd have to pay that. Medigap, you're dealing with paying directly to the insurance company, as well as Part D, the prescription drug. And there was a lot of news about the donut hole in prescription drug coverage, where it would cover drugs up to a certain point, and then there was a hole that wasn't covered. And that can get expensive. So you're dealing with expenses that can sink the boat if you don't plan for them. Now, kind of interesting on the other side, when you go Medicare Advantage, that Medicare A is for the hospitals is still covered by the government, and the premium is still collected for Medicare B, and then it's handed over to the insurance company. So, the enrollee still pays it, but it goes someplace else. So it's on the back side. You don't see that. But because Medicare Advantage is allowing the HMO type cost savings, utilization review, and those sorts of things, the premium out of pocket to the enrollee is sometimes zero. And I actually have a friend who's now just turned 70. He actually gets a rebate from the company. So he's charged a negative premium because, he's on the younger side, being only 70. He's riding his bike all the time. He's doing all sorts of great healthy things, and he's being rewarded by being able to have a rebate on his Medicare Advantage premium. So that's not going to break the bank, but you have traded it for a more narrow network, which, if you're used to that, it's no big deal, perhaps. And that's likely to cover all your prescription drugs as well. So with careful planning, yes, you can piece it all together so it won't break the bank. But if you leave yourself open and don't pick up all the pieces you need, if you go the traditional route, yeah, you could expose yourself to a disaster down the road if you're not covering yourself. Medicare Advantage, it's all one package, so it's harder to fall into a hole there.
So it covers. So if you have Medicare Advantage, A, B, and D are all covered, but then there's still sort of the co-pays and co-insurance, everything else. Is that wrapped into Medicare Advantage, or do you still need MedSup?
No, you do not need MedSup if you have Medicare Advantage. And Medicare Advantage will have whatever co-pays and deductibles are associated with that plan. So the companies that offer that are free to kind of build that how they think it's going to be attractive to the market. So you do have to look at that, and yes, that's yet another decision tree you have to go down. Do I want, which of the insurance companies do I want? What are the premiums? What are the deductibles? Is my doctor in it or not? Does it have the hospital I like or not? And then what are the financial associations with that, with deductible copay and such?
So Terry, can people change from going with a Med Advantage plan to a Med Sup plan, and can they also change the level of protection that they have on an annualized basis?
Yes, every time open enrollment comes around, you are free to change around as you wish. Change company, stay with the same company, go out of Medicare Advantage into traditional Medicare or back. That's all during the mad shuffle of open enrollment, which is why your TV and your inbox light up with all these sales pitches. Basically, that's what they are during open enrollment season.
And do pre-existing conditions have any play in terms of what's available or eligible to the individual?
Not typically. As long as you have kept yourself covered. As you switch from one to another, the pre-existing is not an issue. If you've somehow let yourself lapse and gone without, that could be an issue. The ACA has something to do with that, and so that may well have gotten rid of a lot of that issue. But nonetheless, it's not smart to let it lapse. Don't leave yourself in a hole.
Yeah, Mark and Ramsey, I had the hardest time getting my head wrapped around the fact that every product is identical by law. So a Plan F is a Plan F. The only thing that matters, that varies, Terry, right, is the premium. Now the carrier, maybe you have extras the carriers have layered on top of these, but it's the same product. So, if I'm an agent, I don't really think I can actually sell. I think it's tell me if I'm wrong. I think it's rare that as an independent agent or advisor, I can sell a Medigap policy and receive a commission, correct? Most of that is sold directly by the healthcare provider. Am I mistaken?
Yeah, I believe they are sold by agents, and you will get that commission, but you are basically selling on price. And perhaps there's a service element on there.
Right.
If you believe, health carrier A has better service than B, you may be willing to pay the higher price for it, but it's very much cost cost driven on that. But agents do get involved in that, and there is compensation there.
And then I guess a really big question is, where's the puck going? If I am gearing my office or agency or partners up to tackle the market this time around, obviously some changes. You mentioned how Medigap policies have changed. I know for a number of years agents were really promoting Plan F. Plan F is the plan that has the lowest deductibles. At least, Terry, you can correct me if I'm wrong, but it feels like G has picked up a lot of head of steam with in the marketplace today. How would you describe how the if we were to when we see how the dust settles in January, what are people going to say? Oh, this is what happened in the marketplace.
Yeah, how they spread out amongst the various, popularity on the spectrum of A through G or however far the letters go these days. I'm really not sure, because when I'm looking at it from the industry standpoint, all of my information comes from the NAIC as filtered through S&P and the filings, and that breakout isn't out there. And so I see the number of members coming in, and I can see the premium and such, but I don't know which plan they're in. So anecdotally, you've talked about F being popular and perhaps G gaining. That's information I don't have direct contact with, because it doesn't come through the annual filings. I can see who's playing it. I can show that it's really concentrated by carrier. I mean, the top 10 have 72% of the Med Sup premium. So, once you get past that, it drops off real fast. So you've got all your big name players, but which plan they're in from that, that's information that doesn't come through on the exhibits that I'm looking at and reporting on.
Terry, is there any typical rule of thumb that people use to determine which direction to go, whether to go more towards a Med Advantage plan or a Med Sup plan?
Yeah, the rule of thumb is not so much, which benefits and, what conditions I have and all that. A lot of it is the comfort of the person making the choice. You get, my parents are in their low 90s. They have traditional Medicare because when my dad retired in, 1990, he came out of a company and he was used to indemnity insurance, and that's essentially how traditional Medicare works. It works like the old indemnity insurance plans that you may have gotten at as an employer. Here I am, approaching Medicare. I've still got a couple of years, thank you very much. But am I going to go to Medicare Advantage? Very likely so. I've had an HMO or a PPO type coverage for almost my entire career. I'm comfortable with it. I know how they work. I know who those players are. I've had my insurance at various times with a lot of those top 10 players where, would I have a choice between A, B, and C and all that? Yep. I'd check my doctors. I'd check my the hospitals in it and go with the one that matches it best. So I think it's very much age driven. Every year, the next batch of people hit 65, and they're obviously younger than all the ones that have continued to age on beyond, and they're more and more comfortable with the HMO PPO setup. And so, we've seen Medicare Advantage double its enrollment between 2010 and 2020. Went from like 1.1 million up to 24 million in these past 10 years. It's currently 39% of the market is in Medicare Advantage. And if you're selling Med Sup, your competition is you're talking about competition amongst all those carriers, but the other piece of the competition is they could drop it all and go to Medicare Advantage. So that's really another piece of competition there, and that's going to be likely the more predominant choice going forward for all these people just turning 65. It's been so much ingrained in them for their working career that it's simply comfortable. It's just, okay, new plan of benefits, but it's Medicare. Got it. Same hospital, same docs. I'm good.
So I wanted to get your sense of, the conversations that you have with your clients and the things you write about in your reports. I suspect that they're more macro than what we've been talking about so far. So I assume they deal with things like balance sheet health, the risk in the industry, et cetera. What are your thoughts of the current state of the industry in terms of providing protection against this risk and prospects going forward?
For the health insurance industry specifically, because obviously we're talking about senior health here, the health insurers are quite healthy right now. COVID was seen early on as probably a very big expense coming out of the pandemic and such, and rightly so. Here's this disease we don't know anything about, and we're scrambling to do stuff. But what happened very interestingly was a lot of things, as we shut down, a lot of healthcare got delayed. And so, knee replacement. Well, I can hobble along for another 6 months until things calm down. Why do I want to jump into a hospital where all these COVID patients are to have my knee done when I can very easily just put it off for a little while? And that's what happened. A lot of screening, a lot of elective, not elective in the sense of optional, but things where the timing on it is not urgent, got pushed back. And so health insurers were in almost the embarrassing situation of making too much money because all this utilization went down. And yes, COVID expenses went up, but that was not nearly as much as the quote unquote savings of all these delayed procedures. Now, those procedures didn't go away. They will simply get worked through the system. But the insurance company started to cover 100% of COVID expenses first dollar, which was great because, in a pandemic, that's the last thing you want to worry about. Here, I've got this thing that nobody knows what's going to happen to me. And, I've got $100 to go to the doctor. Yeah. Okay. So they started paying it first dollar, which, first of all, it made for good public health sense, but it also was, a very good public relations as well. So let's not discount that. That was, they were on the forefront of being active to keep people healthy, which is great. Everyone benefited from that. But the insurance industry actually made more money. They are now reinvesting that back in, and they are rebating and such like that. So it's not just, they're running to the bank. They do have to put that back into healthcare services, and those services will come back. And so those knee replacements and all those things, they will catch up. And so, it's just a timing issue. But overall, yes, they've done well and are healthy.
Yeah, it's fascinating. Looking back, we'll say, it was so obvious that we thought this would happen, and the results are counterintuitive. Yeah. Very counterintuitive. This is kind of news to me, but I look back and think of all the text alerts I got from our provider saying, "Hey, we have appointments open." I was getting these emails. I thought, okay, or notification. I thought, okay, they need business, but I didn't think about how that would translate for the health insurers. Kind of continuing along Ramsey's line, but trying to connect back to advisors. If I'm sitting with Mark, planning doing an income plan in retirement, based on what we saw before, based on what you saw during COVID, based on what you're seeing before, what type of inflation should I factor into a plan? If either Med Advantage, got to pay for Med Advantage, you got to pay for Med Sub some way. Well, what kind of factors should we be using on an annual basis?
To actually throw out a number, it's like, there's a prediction that I don't think anyone really wants to make. But if history continues, which there's no reason to think it's not going to continue on, health inflation, cost of care has been several percentage points over the general level of inflation for years now, and no amount of managed care has really reined that in, at least on the global level. I mean, yes, for groups of employees or groups under Medicare, that can be controlled, but it has not been a rousing success in controlling it on the macro level. Do we end up with a Medicare for all or some sort of national health insurance? That's obviously a political debate that goes far beyond what we're doing here. And there's no guarantees that even that would rein the cost in. You look at other countries and they have medical inflation higher than their general rates of inflation as well. It obviously varies all over the board. But yeah, to plan for retirement, yeah, take what you have for your regular inflation and put your thumb on the scale quite a bit, and then leave some room. Um, I do not envy someone trying to actually pick those numbers. Other than it's probably no matter what you do, it's almost not guaranteed to be not enough. That's a cynical statement, but unfortunately, there's a grain of truth behind it. It always seems to be more than we think.
What's the kind of weighting in terms of the different? You mentioned like C, D, E, F, all of the G and beyond, perhaps. What's the weighting in terms of where the lion's share of that premium is going into which type of plan?
Yeah, that's the part where I don't have where that goes from the statutory statements. And if it is buried in the back, it's not. We're typically looking at it on the macro level from the product overall. Medicare supplement is only 3% of the entire health insurance industry's revenue. 3%. Medicare Advantage is 30%. And then, group comprehensive and such is like a third of it. So we're typically looking at all those larger products, and MedSup, yeah, we keep our eye on it, but it's only 3% of the revenue. It's a big product in the eyes of the retirees because it's an important product for them, but overall, it's not a huge one for the health insurance industry in total. So, I think there's probably a schedule way in the back of the statutory statements that I could find that might split that out, but I have not looked at that. So sorry, I can't shed too much on that. So.
No, well, but you did mention that I think there's enormous concentration of premiums among the
Yes.
top 10 players. Now, I'm sure there'll be imminent mergers and acquisitions among those top 10, but if I'm an agent in a local community, can I do you see any type of like reversal of trends? Do you see small company? Explain to me these other carriers beneath the top 10. Like, do you see growth in regions with some of these the smaller carriers? Overall, is it growing, shrinking? Are those 10 players going to effectively gobble up the rest of the market over the next 5 or 10 years?
Yeah, the top 10 have increased their concentration over the years. I'm looking at it for 2020. I mentioned it's 72%. If you dial it back to 2011, those same 10 companies had 65%. So they've picked up a decent 7 points over the past decade.
Yeah.
And some of that is through M&A. I mean, United Health has been buying all sorts of different things over the past decade, and they are currently at the top with like 32% of the market. The next one down is Mutual of Omaha, which is not even a traditional health insurer. They have a variety of ancillary type coverages, but this is a big piece of their business, and they're number 2 out there. And then you go back, the next one down is Aetna, and then Anthem, and then Healthcare Service Corp, which is a Blue Cross out in Illinois. So then you get back into those insurance carriers. But those tend to be, those insurance carriers have a huge footprint. They've got the claims systems already set up to cover their huge group comp business. And this is just another product that needs to pay benefits. And so they definitely have an advantage to keep that market share. I don't see a lot of smaller companies trying to break into this. You get down below the top 25, and some of these are, all I get is smaller and smaller carriers on the health insurance side that they basically are not going to be able to expand beyond their local footprint. You're not going to have a company centered in Vermont, just to pick a state, suddenly starting to sell MedSup in Los Angeles. Nope, not happening. Um, so those trying to break into that is going to be tough, and to kind of get out of your own region. So those big players are gonna I think keep expanding their presence.
So you like investing in the space?
My personal investments are elsewhere, just because. Yeah,
Well,
yeah,
I don't mean to. I don't mean to ask about your
Yeah.
personal investments, but just sort of like as you talk to your
Yeah.
clients who are considering investing in the
Yeah.
space, are you buy, sell, or hold?
Healthcare in general, I would be buy. There's a lot out there, and even if national healthcare goes through, there's got to be a way to administer it. You look behind traditional Medicare Part A and Medicare Part B. The federal government, yes, is funding that. They don't pay those claims. They don't physically adjudicate them and cut the checks. They farm that out to Aetna and United Healthcare and these other companies that have the infrastructure to do that. So either way, whether we do national health or not, those companies are positioned to have a piece in whatever that looks like going forward. So I would be buy on that. Because the health industry, hospitals and doctors, they need to get paid. They need to get paid somehow. Right now, the mechanism is through these insurance companies, and that's not going away anytime soon. And in fact, I think it's going to actually get, larger regardless of the path. It'll be different, but it's still going to be big. So I would be buy.
Okay, I just put my trade on Robinhood here. Okay, so we'll come back in a year and Terry, see how I did. Hey, so this has been great. So we're close to the end of the show. Hey, Mark, final questions, final thoughts for Terry?
Yeah, Terry, I guess if an agent is looking to expand their business model into this space, what's the best resource to go to really learn about all the different programs available?
The various company websites are, especially to the point where they're actually aiming at the customer. There's a lot of good resources out there for learning about the different products. When you're doing MedSup specifically, your letters are, once you know your letters, sing the little ABC song, you've got those. They're defined by law. If you want to start talking Medicare Advantage, then you've really got to know your local market. If you're in an area where one particular carrier is strong, you're going to need to be up on how that carrier puts together its Medicare Advantage plans and what options are within it. Because, there's a lot of different, even in the same carrier, they'll have several different plans and they'll have different perks. They'll give memberships to gyms and all sorts of things like that. So knowing that market is going to be very localized compared to MedSup. It's national in scope. Typically, you've got a lot of players out there that are like a Mutual of Omaha that'll sell all over the place, and you've got standardized products. So yeah, those customer-facing websites are going to give you a lot of information for those, for both of them, and then you're really going to need to hone in on your local market if you want to start talking Medicare Advantage. And the new people to Medicare may well want to go that way because it's very familiar, at least the concepts of an HMO or PPO.
Medicare ABCs. I think we've got the title of the show.
Yeah, there you go.
Ramsey somewhere here. Ramsey, what else?
So thanks for taking the time to discuss this issue with us. Despite a multi-decade experience in derivatives and many parts of the insurance industry, I find health insurance to be extraordinarily complicated. So thank you for enlightening us. And you said something at the beginning. You're focused on ESG, and next time you come back, I think would love to hear your thoughts on the impact of ESG on the insurance industry, because I think there's a lot on the horizon.
Certainly is. I'm actually writing a series of 4 studies on it right now. 2 of them are out the door and on the library. The third one's still in draft format, but is due out at the end of September. So.
Yeah. Oh, Terry, we'd seriously love to get you back here. We've had a lot of discussions around, role of ESG inside products, that we're offering. So I think that would be a great topic. Terry, listen, thanks so much. Healthcare is one of those important topics, and I think if you're sitting down with a client trying to help them plan for retirement, how do you not understand Social Security? Even if you don't sell Medicare, you better be able to explain this to them and be able to answer questions. And I do need to learn my ABCs a little better than I do. I know Plan F. I know Plan G. I'm getting there. I didn't know Plan C was Medigap.
Plan C is Medicare Advantage. So, that's where the letter C went. It disappeared.
Medicare Advantage, excuse me. Medicare Advantage. Okay. Hey, great to know. So, Terry, now I know you have to have a subscription for Conning to get some of your work, but for people who are listeners who want to read a little bit more, especially about your perspective of the healthcare industry as well, where can they go?
They can go to conning.com, our website, and yes, you need to have a subscription. Sometimes you can buy single copies of our anything in our library, so you don't have to subscribe to everything. You could buy a one-off copy of anything that's out there as well. And if you go to conning.com and click on the tab for the library or search for it, that will give you the contact name of the person in our office that would be able to get you set up with either a subscription or a one-off copy of anything we've got in our library.
Okay, great. We'll find the link and put it in the show notes for anybody who wants to look. Just look on your podcast feed and click in to get it. So Terry, thanks so much. Hope to have you back. ESG would be another really good topic to dive into. And Mark, thank you. Ramsey, as always. And thanks to all our listeners. And tune in again next week for another episode of That Annuity Show.
Thanks for listening. If you've enjoyed the show, please rate and recommend us on iTunes, Stitcher, Overcast, or wherever you get your podcasts. You can also get more information at thatannuityshow.com.